Okay. Hi, I'm Ashley Sturgeon. I'm an attending dermatologist here at Texas Tech and the president this year of the Lubbock County Medical Society. And I'm here with my friends, uh, Colonel Dr. Dickerson of the Air Force Reserves, who is president-elect of our County Medical Society, and Dr. Stahoviak, who was one of my attendings in internal medicine, and she is co-president of the Alliance this year. Oh, Dr. Dickerson is also an officer in the Alliance as well. So we wanted to talk to you today a little bit about what the County Medical Society and its partner institution, the Alliance, do for residents and their families here. So I thought I'd start by telling you a little bit about my journey in the County Medical Society, which started as a third-year medical student when I was applying to dermatology. A friend said, you know, you should really be involved because there's dermatology attendings who are involved in the medical society, and that'd be good for your resume and a good connection for you. And it was, and I matched into derm. And as a resident, I was still very active in the County Medical Society. It meant something different to me at that time because I was so busy. And as an intern working 80 hours a week, I think it was a lot, but I was still very active on our membership committee, which helps us get more members and support our members however they need. I think when I was in your shoes, I filled out a form that got me my dues paid free. So all of you have paid for memberships to the County Medical Society. And so that's a really important thing. And I think it may be something that residents took for granted until this year, because we would have residents occasionally show up to our family events and their families would show up to our Alliance events. But this year it became real when we did a huge PPE drive. When this COVID stuff really started kicking up, people got very scared and didn't have access to even one N95 mask. And they thought, gosh, what if I think I'm seeing a COVID patient that hasn't even, this was before testing was really even prevalent. And so we didn't know, and everyone with a cough was COVID. And, we were knowing that other young doctors who were perfectly healthy were dying from COVID. And so there was a lot of fear and angst, I think, among residents who are truly on the front line. And we were able to get PPE through very generous donations through our County Medical Society and distribute those to our resident members. So residents were contacting me saying, am I a member? Am I a member? And so make sure to fill out your form because it's really, really became important to a lot of residents this year. And so I think what we are to residents and physicians is much more than that. But we're kind of the pinch hitter this year for PPE very early on in the COVID crisis. So I think there's a lot of things that we do, political activity, organized medicine, these kinds of things. I'll let Dr. Dickerson talk more about those because she's really the expert here. But I just wanted to tell you what my experience was as a medical student, resident, and then now attending through the County Medical Society. So I'll turn it over to Dr. Dickerson so she can pick up what I've missed.
Okay, well, thank you, Ashley. I've been a member of the County Medical Society since I moved here a long time ago because I'm an old doctor. And the great thing about our local County Medical Society is that we get involved. We look at ourselves as the family of medicine, that all of you are part of our family now. And you're all members. The TMA makes sure you're members. And one of the big things we do is political activism. One of the things that came up during the COVID crisis was that because of the resident members, the student members, and the county medical societies, we saved our public health department. They were going to do away with it. And all the people in white coats showed up and did that. And a lot of them were students. And they got very active there. So there's lots of opportunities for people to be politically active. We have social activities, we have volunteer activities, mostly that the County Medical Society Alliance sets up. They also set up a lot of the other activities, the social activities. And you can get involved at the state level as well. Many of our student and resident members are active in the resident and student section of the TMA, and they go to the House of Delegates, if we ever have one again. Maybe it'll be virtual like this, and can get policy change. And they've done that. They've changed policy at the state level. They've changed policy at the AMA level. So there are lots of lots of ways to be involved. And if you don't end up staying in Texas after your residency, well, then you can go and join the Wyoming State Medical Society or the Massachusetts State Medical Society, which are also very active, or the California State Medical Society, and have your activism continued. If you stay in Texas, well, we'll just hand you off to another county, and they'll welcome you to their particular organization, and you'll have colleagues and friends already when you move to the new town, whatever hospital you're working at or wherever you're going. I'm going to turn this over to Dr. Skakowiak now, who's going to talk a little bit about the Alliance and how to join.
Okay, just to reiterate, the Alliance is an organization that's for physicians, but also physician spouses and their partners and medical students. We help support the activities of the County Medical Society, and it's already been mentioned, but we've been helping to organize the PPE that we've been getting from FEMA and donations from businesses for community physicians. We help with social activities. Lately, that's been by Zoom, and also with health fairs, vaccination events. And we have one that is currently scheduled for later in the fall at the food bank and one of the homeless kitchens to give the flu vaccine. I'm going to explain this form. For the Alliance, we have a membership form. And I know it looks a little fuzzy, but you should have this available. On the surface, it's a little confusing because it's a generic form for all categories of membership. But the main thing to remember that as a resident, it's free for you to join and for your spouse. The local dues are free. There are state dues that's $1 for yourself or your spouse or your partner. But we will make sure that gets taken care of. Our local organization will pay for that with the state. On the form, again, you can ignore these other dues categories that are for other types of members. Some of this is self-explanatory. You'll check off physician, put your name, address. If you don't want to give us your phone number, you don't have to. We really need your email address because that's how we communicate with you. If you have a spouse or partner, you can put their name down. We would appreciate their email address also. And also what area that your specialty is in. If you fill this form out today, you can turn it in to the GME office, or if you want to do it later, just get in that week, and I will pick it up later in the week and get everything squared away for your membership. I want to really, like everyone else, encourage you to join the County Medical Society and the Alliance. We understand that you guys are extremely busy, but if you join, you can be aware of our activities and how we can help you now and in the future. And that's all I have.
I had two things that I forgot. I wanted to tell y'all just briefly a story that through my connection, and when I was a dermatology resident, we didn't have rheumatology staff in the hospital. And so I had a patient who was dying of dermatomyositis, like large muscular failure. And I had no one to help. And I had a friend through the County Medical Society who was a rheumatologist who came in after hours on an unfunded patient to help me get that patient taken care of. And that patient is alive and doing well today and now followed by that rheumatologist. So that was a connection that kind of saved my patient, really, someone that I really had to advocate for because there was no rheumatologist at UMC at that time. And so, you don't realize kind of the things that can be beneficial for you. Another thing I wanted to point out that the Alliance is working on that I meant to mention earlier is mental health support for children of physicians, because the kiddos are just as scared as their parents are, and they hear all these things on the news and don't really understand. And so the Alliance is working for support, and we're not sure what we're going to do yet, but maybe we were kind of thinking like support groups for kids that are age appropriate, so kids can talk to other kids and maybe voice their concerns about what's going on. And then another thing that we're working on is mental health support that would be non-punitive and not reported for physicians who are members. And that is available to you through, I believe, UMC and the Health Sciences Center, but we would like to be another avenue if maybe you want to go outside the system. So these are things we're working on and what I see happening in the future for the County Medical Society at a local level. So is there anything else we should talk about, Dr. Dickerson, Dr. Stachowiak?
No, I think we've pretty much covered it. They can always call the County Medical Society office. Juanima Christensen and Margaret Harper are two very excellent staffers who work there. You know, we'll pass on any questions to the appropriate person. Of course, you know, you can probably tackle Dr. Sturgeon in the hallway at UMC. I don't go over there anymore because I work in an outpatient clinic now. But if you call Juanima, she can get in touch with us and get you in touch with us.
I like that.
The same
Thank you.
for the Alliance.
Yes, yes, yes. Thank you all for listening to us, and I hope that we can be of service to you or your families during your stay in Lubbock. It's a great place to live and wonderful people here. You can't beat them. And watch out, Lubbock's kind of a vacuum. Sometimes it sucks you in and you end up here forever. So if there's anything that we can do for you, like Dr. Dickerson said, you're part of our family here, and we want to take good care of you. So we're here if you need us. Okay, thanks, guys.